I'm here with Sarah White, who's a PhD student at the Wellington School and the University of Otago, doing a PhD in conversation analysis, and she's just going to have a chat to us about the trials and tribulations of conversation analysis as a PhD method. So, Sarah, tell us a bit about how conversation analysis fits in or doesn't fit in with the normal process and sort of timelines that universities expect of PhDs, and how did that play out for you?
I think conversation analysis, because it's such a detailed methodology with the transcription and things like that, if you're working in somewhere like a medical school and you don't have the people there who understand that for conversation analysis you can use a smaller data set, then the data collection and transcription can take a long time. I think being in a medical school can be quite difficult if people don't understand qualitative methodologies, and the fact that you can have a much smaller data set and still find something really quite valuable in it. So I think that could affect the timeline. But as long as you've got people there who really understand that, you know, I've got 35 consultations, and you know the time it takes to collect those and transcribe those in a CA way is still a valuable amount of data.
So how does things like timelines and schedules and that sort of thing fit into this sort of more exploratory inductive methods of conversation analysis? Does that work all right?
It's worked quite well for me. I think I studied for 3 months at UCLA as well, which really kind of fast-tracked me, I think, with understanding the methodology. And I think that's one problem with doing CA in Australia and New Zealand is there's fewer opportunities for those kind of CA boot camps, you know, that you do get overseas. And I think that but once you have that kind of interaction with people and education, you can really improve the quality of your work and the speed you can work at, rather than trying to find your way around the methodology in an unsupported way.
So it essentially takes having a supervisor who's already the expert in something like conversation. It's not something you can teach yourself.
It's really difficult to teach yourself, and even if you have a supervisor who doesn't have as much knowledge, as long as they're interested and there's a group of people that you can really tap into. So in Australia there's CA groups in Brisbane and Melbourne and Sydney and Canberra, where you can tap into that kind of expertise, and as long as you've got people there who can do that and who can guide you, because it's a very complicated literature. It's very diverse areas, lots of different journals, which gets a bit difficult. So I think it's something you can't do by yourself.
So what's the best part of doing a PhD using this sort of methodology for you?
I think the best part about doing a PhD with CA is that you really find out what actually happens in the interactions, and I think it makes it very real. It's not this abstracted, quantitative number thing. It's not even just people's perceptions. It's an actual real thing that's very tangible, and it really engages the people. If you're working with institutional interactions particularly, you get to engage with people a lot more with your findings. They're really interested in it because it really pertains to them and their practice.
So in your studies, for instance, how has that played out? You mentioned institutions. What institutions and what kind of benefits does that have?
So mine's surgeon-patient consultations in clinic settings, and so just feeding back to some surgeons, not necessarily who are part of the study, but just being able to show them that their practices are different from primary care interactions, and that there are ways of looking at their practices and understanding them which haven't been done much previously.